If you've always wanted to be part of a team of medical professionals working in the operating room, then becoming a surgical technologist may be the right career for you. Let CT State Community College show you what a surgical technologist does and how you can contribute to having an impact in the life of a patient. The surgical technologist, frontline member of the surgical team. The surgical technologist is a trained and certified professional that works alongside surgeons, anesthesiologists, and nurses performing surgeries in the operating rooms of area hospitals and surgical centers. But there is more to surgical patient care than the operating room. There are 3 phases to surgical patient care: pre-operative, intraoperative, and post-operative. The pre-operative phase begins with establishing sterility, which is critical to patient safety. Sterility involves identifying and maintaining clear boundaries between sterile and non-sterile areas, instruments, and team members. Creating a safe, sterile environment for the patient starts with scrubbing. Scrubbing procedures are highly detailed and must be performed exactly the same way every time. This is followed by equally detailed procedures for gowning prior to surgery. Gowning of sterile team members requires the assistance of another non-sterile team member, such as another surg tech or a nurse. The surg tech is responsible for picking and opening the sterile instruments for the surgery and placing them on the instruments table. Additionally, they perform counts, measure and label liquids, and collect and label specimens. Finally, the preparations for surgery include prepping the surgical site and opening and positioning drapes over the patient. Before we discuss the intraoperative phase of surgical care, let's go over the aseptic field and the roles of the sterile and non-sterile team members. The operating room consists of 2 areas, the sterile area and the non-sterile area. The sterile area is also referred to as the aseptic field and consists of the patient, surgical drapes, instrument table, and the sterile team members. It is critical to maintain sterility of all people and objects within the sterile area in order to control infection and maximize patient safety. The sterile members of the surgical team typically consist of the surgeon and the surg tech, working closely together over the patient within the sterile area. Other members can include residents and a variety of medical, PA, and ST students. The surgeon is a medical doctor that is in charge of the entire surgical team throughout the entire surgical procedure. The surgical technologist takes direction from the surgeon, as does the entire team. Other members of the surgical team are typically non-sterile and include the circulator, the anesthesia professional, and additional non-sterile nurses or surgical technologists. The circulator is a registered nurse who is responsible for assisting the sterile team with tasks outside of the aseptic field, performing patient skin prep and assisting with draping the patient. The circulator also maintains all the surgical documentation during the surgery. The anesthesia professional can be a doctor or a nurse anesthetist that is responsible for administering anesthesia and monitoring the patient's vital signs throughout the surgery. The intraoperative phase of surgical care consists of the members of the surgical team each performing their roles as part of the surgical procedure. The surgical technologist that directly assists the surgeon is known as the front scrub. The front scrub's primary role during surgery is to assist the surgeon by handing off instruments, retracting, and collecting and labeling specimens. Assistance begins with understanding detailed anatomy and physiology, studying the entire surgical procedure beforehand, and anticipating the surgeon's needs at all steps of the procedure. It is critical to the patient's safety to maintain sterility during the surgery, so surg techs must be vigilant and adhere to all practices and protocols to avoid breaking the sterile field. The surgical technologist is a professional and should always remember to maintain a caring and cooperative attitude towards the patient and the entire surgical team. The final phase of surgical patient care is the post-operative phase. This phase involves performing post-operative counts of instruments and sutures, cleaning up surgical supplies, and preparing equipment for transport out of the operating room. Your path to becoming a surgical technologist begins with your study at CT State Community College. Surgical technology students must complete an accredited program of study consisting of didactic classroom instruction, lab instruction, and clinical rotations. Accreditation is granted by the Accreditation Review Committee for Surgical Technology and Surgical Assisting, known as ARC-STSA, operating under CAHEP. Coursework includes microbiology, pharmacology, surgical procedures, and medical terminology, as well as lab courses for hands-on instruction. Students are also required to complete 30 weeks of clinical rotation at area hospitals and surgical centers, observing and working on actual surgeries. Graduates obtain an associate's degree in science with a surgical technology major from CT State Community College. Upon completion of the program, students must sit for the National Certification Exam. This exam is administered by the National Board of Surgical Technology and Surgical Assisting, or known as NBSTSA. In 2023, the state of Connecticut requires students to pass the exam and become a certified surgical technologist for employment within Connecticut. Right now and for the near future, the job market for surgical technologists is very strong within Connecticut and nationwide, and the field is projected to continue growing. Student graduates can get jobs in hospitals and surgical centers, with future opportunities to move into other jobs such as educators or sales representatives for the healthcare industry. The Association of Surgical Technologists, or AST, is a professional organization for certified surgical technologists. AST supports program accreditation, national certification, and continuing education. AST membership entitles surgical technologists to attend annual conferences, attend continuing education courses, network with other CST professionals, and access to other professional resources. For more information, go online to ast.org.